Welcome to our channel.
Bradykinesia is a therapeutic term used to depict moderate development or failure to move the body rapidly on request. While it can occur with different conditions, it is frequently connected with Parkinson's ailment and is one of the primary manifestations specialists use to analyze the sickness. Bradykinesia can likewise be a reaction of meds or a manifestation of other neurological issues. Quick realities on bradykinesia. The most evident side effect is strangely moderate developments and reflexes. Specialists may attempt a few distinctive treatment alternatives for a man determined to have the sickness. Lamentably, bradykinesia and different side effects of Parkinson's illness have no known cure. What is bradykinesia? The condition is basically moderate or troublesome body development. There are changing degrees of bradykinesia, and they can frequently mean ordinary developments, for example, lifting arms or legs, take any longer. Parkinson's illness is the fundamental driver of bradykinesia. As Parkinson's advances through its stages, a man's capacity to move and react rapidly decreases. Manifestations. Notwithstanding moderate developments and reflexes, a man may involvement. Fixed or solidified muscles. Constrained outward appearances. A rearranging walk. Trouble with dreary undertakings. Inconvenience finishing self-care and day-by-day exercises. Dragging a foot while strolling. Individuals with Parkinson's may likewise see a powerlessness to talk obviously. As the sickness advances, discourse ends up plainly milder and considerably harder for others to get it. Conclusion. There is a particular test used to analyze bradykinesia. The test is known as the Bradykinesia and Coordination Test, or BRAIN. Amid the test, a man completes a progression of quick taps on a console with substituting fingers for one moment. A specialist at that point scores the test to help decide the analysis. The test score depends on the quantity of right keys hit, the quantity of wrong keys tapped, to what extent it takes to hit the keys, the time isolating every keystroke. The BRAIN test is viewed as an extremely solid instrument for specialists to utilize. The outcomes are utilized to help decide whether somebody has bradykinesia and the phase of Parkinson's they have come to. Treatment. Senior lady practicing in a pool. Light exercise, for example, swimming, might be prescribed to mitigate bradykinesia. By and large, it is conceivable to treat effectively a portion of the manifestations related with bradykinesia. A specialist may first prescribe that a man tries way of life changes to help reduce side effects. A man can for the most part observe some positive outcomes when rolling out these fundamental improvements. In any case, it is critical for them to counsel their specialist before making modifications to their day-by-day schedule. A few changes to converse with the specialist about can include eating a more restorative eating routine, strolling more, swimming, prudent strides to abstain from falling, for example, utilizing a stick or walker, beginning non-intrusive treatment, expanding fiber in the eating routine. Many specialists additionally suggest medicine in conjunction with way-of-life medications. A specialist is probably going to recommend a solution that expands the body's dopamine level. Dopamine can be found in carbidopa levodopa, MAO-B inhibitors, dopamine agonists. The treatment procedure frequently includes a ton of experimentation. A specialist should frequently attempt a few medications previously discovering one that works for a person. To make it considerably more troublesome, the majority of the medications lose their adequacy after some time. This implies a specialist should as often as possible change drugs or the dosages to enable a man to accomplish their coveted outcomes. There is likewise a surgical methodology accessible for a few people. A specialist may prescribe a man tries profound cerebrum incitement. This methodology includes surgically embedding anodes into the cerebrum. These anodes are utilized to send signs to the cerebrum, which enhance development speed and timing. This surgery is normally performed on individuals who have not reacted well to drug. Causes. Beside Parkinson's infection, a few drugs can cause bradykinesia. Antipsychotics and different medications used to treat neurological conditions are normal meds that can make a man encounter side effects of bradykinesia. Researchers don't know why this happens, as insufficient research is accessible to decide the basic reason. Takeaway: more seasoned couple and room. Way of life changes and helps can enable a man to oversee bradykinesia. There is no cure for bradykinesia. There are researchers who are examining medications and cures for Parkinson's and bradykinesia, and this gives trust that a cure will be found in the long run. Way of life changes, pharmaceuticals, and, now and again, surgery are generally successful strategies to help treat side effects of the turmoil. A specialist or physical advisor is a phenomenal asset to build up an at-home treatment intended to oversee side effects. Essentially, a man ought to counsel their specialist before rolling out any improvements to their treatment design, even little ones.